ELCC is an annual conference. It's a co-shared conference from two major societies, the International Association for the Study of Lung Cancer and the ESMO, the European Society for Medical Oncology. And it's an annual update that we do have on thoracic oncology. So we do invite colleagues from all over the world to get current information about the status of diagnosis and treatment of patients with non-small cell lung cancer, but also other thoracic tumors like mesothelioma, small cell lung cancer, or thymic cancer. So we have two big areas where we had our oral abstracts and the oral presentations. Number one was in the field of targeted therapies, and I would talk about two trials. Number one has been an update on the APPLE trial, which is a very interesting trial on patients with EGF receptor mutations, and the colleagues looked on the opportunity to identify the progression after osimertinib first line early by a liquid biopsy and to look whether a switch to a subsequent therapy would provide any benefits. So we discussed this very intensively. And the other one has been an update on sotorasib, a KRAS G12C inhibitor, which was investigated in the Copenhagen 200 trials. And we had very important data on the quality of life and the PRO assessments in this trial. And this also showed quite a striking benefit for the treatment with sotorasib compared to docetaxel in pre-treated patients with a G12C mutated tumor. Well, the other big pie is to talk about immunotherapies, and there I think we had a couple of exciting data. One was the 3-year update of the CheckMate 816, confirming the efficacy of neoadjuvant chemoimmunotherapy compared to chemotherapy in patients with resectable non-small cell lung cancer. We had the 3-year event-free survival data. We had an update on overall survival and biomarker, and we also have got an update on the efficacy of a novel anti-PD-1 antibody, the cemiplimab, which was investigated in combination with chemotherapy in the Empower Lung 3 trial, and which did show a consistent efficacy across all histologies of patients. And interestingly, there was a large number of patients with squamous cell carcinoma who have been treated. So we had a couple of interesting data that we discussed here at the ELCC. We are talking about a growing number of treatment opportunities, in particular using immunotherapies alone or in combination in patients with non-oncogenic driven non-small cell lung cancer. And of course we are looking on overall survival, we are looking on progression-free survival following the different trials that we have undertaken. I think we need to look very individually on the patient. We need to look on the patient profile, the oncogenic profile, the tumor burden to make our decisions. So for example, we have seen that in general for non-squamous non-small cell lung cancer, the combination of platinum pemetrexed and pembrolizumab turns out to be a very effective combination. On the other hand, we have seen quite encouraging signals for patients with PD-L1 negative tumors for the double IO, like we have used in the CheckMate 227 or in the CheckMate 9LA. So we have, I think, a growing picture, but we have to look on the individual patient. I think something which is quite new is the monotherapy, which means the treatment with a checkpoint inhibitor alone. And we have seen in several trials that this monotherapy has been superior to platinum-based chemotherapy. So this has become the current standard, in particular in patients with a high PD-1 expression. And I think this is still the first treatment decision to look on the PD-L1 expression status. If there is a high expression, to consider the monotherapy. And now we need to learn what are the patients that are in need of a combination despite the high PD-L1 expression. And we are learning about additional clinical factors that might drive the decision into using a combination in that group of patients.